Everyone, thank you for joining me today. This is Samantha with Samantha's Respiratory World, and today we are going to focus on the lower airway. So without further ado, let's jump right into it. So we're going to start with the tracheobronchial tree, and this consists of the branching airways commonly known or referred to as generations or orders. As the airways advance down through your lungs, they progressively become narrower and shorter and more numerous. And as you can see on the picture to your left, this is just breaking down the generations and then what is associated with those generations. You have two different zones. One is known as the conducting zone, and one is also known as the respiratory zone. Next, we're going to look at the histology of the tracheobronchial tree. This is composed of three different layers. You have the first one being the epithelial layer, the second one being the lamina propria layer, and then the last is the cartilaginous layer. And the picture to your left is just a breakdown of the three layers that we've just discussed, and also a few extra things like the goblet cells, the epithelial lining, the basal membrane, parasympathetic, and the smooth muscles. So just get an overlook of all these different areas that we've just talked about, and we're going to dive a little bit deeper. So first we're going to talk about the epithelial lining. This is predominantly composed of ciliated pseudostratified columnar epithelium, and it's interspersed with numerous mucus glands and separated from the lamina propria by the basement membrane. As you can see the picture on your left, you can see the goblet cells, and towards the bottom you see the basement membrane like we discussed. And along the basement membrane of the epithelial lining, you're going to notice the oval-shaped basal cells, and these serve as a reserve supply of cells and replenish the superficial ciliated cells and the mucous cells as needed. So now let's talk about the cilia, which is found on top of the pseudostratified columnar epithelium, and this extends from the trachea to the respiratory bronchioles, and there's about 200 cilia per ciliated cell, and the length of the cilium is about 5 to 7 microns. So while still looking at the cell structure as we advance into the respiratory tract, into the lower airways, as you continue to go down, the bronchioles become progressively smaller and the columnar structures of the epithelium decrease in height, and they appear to be more cuboidal than columnar. And the cilia progressively start to disappear in the terminal bronchioles and become completely absent in the respiratory bronchioles. Now looking at the mucus layer, or the mucosa blanket, this covers the epithelial lining of the tracheobronchial tree and is composed of 95% water and 5% consisting of glycoproteins, carbohydrates, lipids, DNA, cellular debris, and foreign particles. It is made up of two distinct layers. The first layer is the sole layer. This is adjacent to the epithelial lining. The second layer is the gel layer. This is a more viscous layer and is adjacent to the inner luminal surface. Next, we're going to look at how mucus is being produced. First, by the goblet cells. As you can see in the picture, these are located in between the ciliated pseudostratified columnar cells, and they have been identified and seen all the way down, including into the terminal bronchioles. And these become empty when stimulated by either an infection or smoke inhalation or dust. And the next the part that can create mucus is the submucosal or bronchial gland, which you can see in the picture. It's down a little bit lower and deeper in the lamina propria. And this produces most of your mucosa blanket, and it extends, like I said, deep down in the lamina propria. And it's innervated by the vagal parasympathetic nerve fibers, which is your 10th cranial nerve. Produces about 100 milliliters of bronchial secretions per day. And its increased sympathetic activity decreases the glandular secretions, and particularly numerous in the medium-sized bronchi, and then they slowly disappear in the distal terminal bronchioles. Now we're going to look at the normal movement of cilia, and just look in the video below, you can see that it moves in a wave-like fashion through the less viscous cell layer, and it continually strikes the innermost portion of the gel layer. And it does this about 1,500 times per minute, and it propels the mucus layer along with any foreign particles that is stuck in the gel layer towards the larynx. And this happens about at an estimated rate of 2 centimeters per minute. And then once it reaches the larynx, it kicks the cough mechanism in, and this helps move the secretions beyond the larynx and into the oropharynx, which this is commonly known as the Mucociliary Escalator, and it is a very important part of the cleansing mechanism of the tracheobronchial tree. Now we're going to look at the lamina propria layer. This is in the submucosal layer of the tracheobronchial tree. It contains loose fibrous tissues that contains tiny blood vessels and branches of the vagus nerve. There's 2 sets of smooth muscle fibers that wraps around the tracheobronchial tree, one going clockwise and the other going counterclockwise. The smooth muscle fibers extend down to and include the alveolar ducts, and the outer portion is surrounded by a tiny connective tissue layer called the parabronchial sheath. The last layer is the cartilaginous layer, and this is the outermost layer of the tracheobronchial tree, progressively diminishes in size as the airways extend into the lungs. It is completely absent in the bronchioles that are less than 1 microns in diameter. So now we're going to talk about the cartilaginous airways. This consists of the trachea, the main stem bronchi, the lobar bronchi, the segmental bronchi, and the subsegmental bronchi. So let's get started and get ready to break each one of these down. So let's get started with the trachea. The adult trachea is about 11 to 13 centimeters long and 1.5 to 2.5 centimeters in diameter. It extends vertically from the cricoid cartilage of the larynx to about the level of the second costal cartilage or the 5th thoracic vertebrae. This is also where the trachea is divided into the right and left mainstem bronchi, and at the bottom before they divide out, that little section is known as the carina, and there's about 15 to 20 C-shaped cartilages that support the trachea and the esophagus, and they share a fibroelastic membrane. Alright, now moving from the trachea down into the mainstem bronchi, there are 3 little facts that I want to share. It is similar to the trachea, as in it is supported with C-shaped cartilages as well. And in a newborn, the both right and left mainstem bronchi form about a 55-degree angle with the trachea. And lastly, the mainstem bronchi are the tracheobronchial tree's first generation. So the right mainstem bronchus is first, and that branches off of the trachea about 25-degree angle. It is wider and more vertical and about 5 centimeters shorter than the left mainstem bronchus. And the respiratory care practitioner must always make sure that the endotracheal tube has not been over advanced and ends up into the right mainstem during intubation. And getting into the left mainstem bronchus, it forms an angle of 40 to 60 degrees with the trachea. Alright, so coming off of the mainstem bronchi is the lobar bronchi. The right mainstem bronchus, it divides into the middle, upper, and lower lobar bronchi, and the left mainstem divides into the upper and lower lobar bronchi. And this is the tracheobronchial tree's second generation. And the C-shaped cartilages that supported the trachea and the mainstem bronchi now form a cartilaginous plates around the lobar bronchi. So now coming from the lobar bronchi is the segmental bronchi, and this is the third generation of the tracheobronchial tree, and there are 10 segmental bronchi in the right lung and 8 segmental bronchi in the left lung, and each bronchus is named according to its location within the lobe, which in the picture to your left is a awesome color-coded picture, and it also shows you the names of each part of the lobe of the lung, and I just thought it was very helpful on bridging the names and the locations of each lobe segment. Now we're getting into the subsegmental bronchi. These are generations 4th through the 9th, and they are smaller airways, and the bronchi diameter range from 1 to 4 microns, and the peribronchial connective tissues containing nerves, lymphatics, and bronchial arteries surround the subsegmental bronchi. So now we're getting into the non-cartilaginous airways, and this is also known as the respiratory zone, and this is where gas exchange happens, and it is composed of the bronchioles and the terminal bronchioles. We're going to go ahead and go into the bronchioles first, and this is when the bronchi has decreased to less than 1 millimeter in diameter and is no longer surrounded by connective tissue sheaths, and they are now called bronchioles. This is found between the 10th and 15th generations, and cartilage is completely absent, and the lamina propria is directly connected with the lung parenchyma, and it is surrounded by a spiral muscle fibers, and the epithelial cells are more cuboidal in shape. So the last part is the terminal bronchioles. This is the 16th through 19th generations, and the average diameter is about 0.5 millimeters. And the terminal bronchioles, they become thinner and smaller channels known as the canals of Lambert. And this is believed to be tiny pathways that may be important as a secondary avenue for collateral ventilation in patients with certain respiratory disorders such as COPD. So that wraps up lower airways. Thank you so much for watching, and don't forget to subscribe, like, and comment below, and I will see y'all guys next week. Have a wonderful day, guys. Thank you.